Hello, I'm Mike Deegan, Group Chief Executive at MFT. After a year in which the NHS has faced unprecedented challenges from COVID-19, I'm proud of the significant part MFT played in responding to the pandemic. I'd now like to look at how our trust is managing the recovery phase and outline our longer-term plans. First, though, it's important to acknowledge that the pandemic is not over. The national vaccination campaign has made a huge difference to the number of people being admitted to hospital and to the severity of their condition. But new infections are still being reported, and we have a relatively high level of COVID patients in hospital now. So we have contingency plans in place to respond to any further surges as we enter the autumn and winter. The likelihood of high levels of flu and anticipated winter pressures are also factored into our plans. We continue to work with public health and other colleagues to support vaccination programmes for both COVID-19 and flu, and to develop specialist services for patients with long COVID. We still expect that COVID-19 and its impact will continue to dominate the NHS landscape for many months yet. MFT has a long-standing set of strategic aims which will help to focus our recovery and transformation plans over the coming months and years. To improve patient safety, clinical quality and outcomes. To improve the experience of patients, carers and their families. To develop our workforce, enabling each member of staff to reach their full potential. To develop single services that build on the best from across our hospitals. To develop our research portfolio and deliver cutting-edge care to patients. To complete the creation of a single hospital service for Manchester and MFT with minimal disruption whilst ensuring the planned benefits are realised in a timely manner. To achieve financial stability. These aims focus on improving patient care and experience, developing our staff and services, bringing the benefits of our world-class research capability to our patients, and of course, balancing the books. The task for the year ahead will be to recover from the pandemic in a way that also takes forward these aims. I'd like to share with you some of the key national developments which will have an impact on our long-term planning and activity. As the country recovers from the impact of the pandemic, it will be important to make sure that the NHS receives sufficient funding and support to treat the really large number of patients whose care has been delayed due to COVID-19. Effective social care services are so important to the NHS as they help minimise the amount of time people have to stay in hospital. This is better for the patient and means we can see and treat more people. The government have rightly highlighted this as a priority, and we look forward to seeing their proposals. National changes to the way services are planned and funded will come into force next year, with integrated care systems being established. Our integrated care system will cover Greater Manchester, and work is underway with our partners across the city region to develop optimal working arrangements. A new leadership team at NHS England and Improvement is in place following Sir Simon Stevens' retirement from his role as Chief Executive. Amanda Pritchard has taken over from him, and we look forward to welcoming her to Manchester to show her how we work and talk to her about our vision and our ambition. Collaboration across systems, including NHS, local authority and voluntary sector partners, was essential for dealing with the pandemic and is equally important for the recovery phase. Embedding and building on this approach is crucial if we are to accelerate recovery and deliver better services for patients. Our Greater Manchester Provider Federation Board coordinated the pandemic response among trusts, prioritising resources according to which organisation needed them most. This effective system-wide working will continue, driving care improvements and tackling existing health inequalities made worse by COVID-19. As the largest trust in GM, our actions will have a major impact on the overall GM picture, and will continue to play an important role in the provider federation. We're also taking a partnership approach to transforming the North Manchester General Hospital site. In March this year, the City Council approved our ambitious plans to create an integrated health and social care campus, which will help to address some of the health inequalities in North Manchester. We're now working with the National New Hospital Programme and commissioners to deliver a shared vision for providing high-quality, modern healthcare to local people. I'd now like to turn to some of our shorter-term priorities. Rather than simply restoring patient services, we want to make them better than they were before the pandemic. Using what we learned over the last 18 months, we can further enhance MFT as an outstanding place to receive care and to work. Our recovery programme is based around 5 key principles: how we operate, reshaping our operating model and increasing collaboration with the wider health and social care system, minimising patient harm, ensuring we have the right staffing and other resources, offering equal access to everyone and preventing hospital-acquired infections, supporting our staff, prioritising staff well-being, recruitment and retention, maintaining a safe environment, focusing on infection prevention and control, minimising COVID-19 transmission, maximising capacity, working with primary and social care partners to care for people at home or in the community. Recovery programmes are closely linked to the implementation of our Hive electronic patient record, EPR, due to go live in September 22. Hive EPR will bring more than 750 electronic and paper-based patient record systems into one, so we can provide better quality care to patients wherever they are treated. But this isn't just about installing a new IT system. It means widespread change in every process across MFT, transforming how we work. Developing our people is essential to the recovery process too, and to achieving our wider ambitions. We want talented people to choose to join, remain and grow within our trust. In April, we launched a roadmap towards creating a working environment that we are all truly proud of and which we value. The MFT People Plan describes the actions we will take together over the next 12 to 18 months. It's based on 5 themes covering every stage of an employee's time with us and highlighting what our people can expect to experience as members of Team MFT. Delivering safe, high-quality care also relies on having buildings and facilities that are fit for purpose, with the capacity to meet increasing demand. Alongside the redevelopment of the North Manchester Hospital site, we also have a bold vision for the redesign of the entire Wythenshawe Hospital campus. This supports our plan to deliver single services across all our hospitals, but depends on securing clinical and other income. A £40 million redevelopment of the adult A&E at MRI is underway, together with significant investment in the emergency department at Royal Manchester Children's Hospital. And we're delighted that our new Oxford Road helipad, the first in the city centre, is now operational. As you will appreciate from this outline, health and care services nationally and locally continue to face both challenges and opportunities. Having seen firsthand the outstanding and sustained efforts of our staff over the past year, I'm confident we will rise to the challenges and capitalise on the opportunities. We will continue to dedicate all our skills and resources to providing high-quality care to all the communities we serve. Thank you for watching our annual members meeting films, and we are immensely grateful for your ongoing support. Our Chairman, Cathy Cowell, will now outline how you can share your ideas, comments and questions with us.
Thanks, Mike. As you say, COVID-19 will continue to have a significant impact on our plans and services over the coming months. There will inevitably be challenges around resuming planned patient care, maintaining infection control protocols, and responding to the usual winter pressures. But whatever lies ahead, I know our teams will be doing their absolute best to deliver excellent care 24/7. We are very proud of their outstanding commitment to our patients, their families, and to each other. We're very keen to hear your comments, views, and questions, and here is a reminder of how you can contact us and see the responses. I would also like to take this opportunity to personally thank all those governors who are standing down this year. We value everything they have contributed on behalf of our members. They really have made a difference during a uniquely challenging time. It remains our absolute priority to provide outstanding care for you, your family, and all the communities we serve. We're also committed to making MFT an excellent place to work for our staff, attractive to scientists and researchers, and widely recognised as a regional, national, and international healthcare leader. Thank you for supporting us in our efforts to achieve this ambitious vision.